us too, live at ACC.24, Fits on the Go. I'm going to ask Dr. Andrew DeFilippis, who is the director of the cardiac ICU at Vanderbilt. He also has a passion on translational research as well. And I was wondering if you have any advice for trainees who are interested in designing trials that have a very pragmatic clinical application, especially with your background, a very strong clinical specialty, CCU, as well as the translational research part.
Thank you for that. Yeah, I think first of all, it's important that your research question aligns with your clinical practice. My interest is myocardial injury, and those patients are in the CCU. Those two things align. I think that is really important when you're talking about doing translational human subject research. So that's my first point of advice. And the second is, right, you need to find something that really interests you. And hopefully that interest will be clinical and research. And that's where you get this perfect alignment, where you know these patients because you treat them every day inside and out as a clinician. And then you are scientifically interested and curious about the question that you're answering, right? And my advice about the question is just twofold. One, make sure you ask a question that really matters, right? Something that when you get the answer is going to have an impact. I think that's the first point, and the most important is that you really ask a question that really matters, not just a question that can be answered. And then the second part is, I think is something that's not talked about as much, but you have to design the way that you're going to answer a question in a way that it can get done. Managing human subjects in research and all that needs to be done to do it is really not scientific or biological. It's really a test of your management skills. And so, use mentors, talk to people, get involved in research projects that others are doing before you launch your own, so that you're in a position to be able to not only ask the right question, but be able to manage the trial to be able to get to a robust answer.
Well, thank you for mentioning that. And I wonder, how do you get your trainees involved in the research that you do, and how do you guide them through the process?
Yeah, this question get a lot from trainees. They say that they're interested, or maybe they'll say they're not sure if they're interested in research, but want to learn more. And they say, but I don't know really, I don't have a question to ask. What question should I ask? And really, I tell them that the question will come with exposure. So, regardless of whether you're ready to start with your own question, I think that you need to get involved and exposed with other researchers. So look around, see what's local, and these days you could even you could look nationally and globally with the way that we're connecting more easily. Find something that you think might be interested and ask how you could help. I joke, I tell people who join my lab the first thing they need to do is watch the original Karate Kid. And the lesson, and then they have to come back and tell me what the lesson is. But for those of you who don't know Ralph Macchio and the original Karate Kid, the lesson is he was made to do all these chores all summer long from his sensei, and then finally, after months of doing this, he had a breaking point and said, "I'm sick of doing all this. I wanted to learn karate." And he in 30 seconds pointed out to him that all along he was gaining these skills and didn't realize it. And I think clinical research is a lot like that. Get involved, you start enrolling patients, you start doing the intake, you do consenting. Next thing you know, you're looking at trial design, get involved with looking at the data, and just doing those little pieces. And in time and with dedication and looking and being conscientious of what you're doing, you'll be able to look back and really be able to harness what you've learned from that experience and put it into your own work.
Well, that's a fantastic overview. I really think you have to understand each and every step that goes into this so that you can design things properly. And thank you for that parallel. It was a wonderful way of looking at things. Thank you very much for joining us today. To watch more videos like this, please check out youtube.com/FITsOnTheGo and follow us on X @FITsOnTheGo.